Okay. Hello, everyone. Dr. Rich Castellano here, the Smile Doctor. And we are doing, I got my camera set up because I'm going to rotate so that you can see the patient. We're here today with Mary. Mary, thank you very much for letting us do your video today, the teaching video. We're going to be doing a facelift procedure, eyelid, and laser treatment. And Mary found out about us on Facebook. And now we're showing her procedure on Facebook and on Instagram and on YouTube. So thank you all for watching. Now, to just give you an idea, these are the pictures that we take from before. So you can see here where the neck and the jawline. So Mary, can you tell us, what was it? How come you wanted to do a treatment? Why did you want to do a treatment for your neck? Can you share that with us? And the upper eyelids too. Why did you want to do a treatment for your neck?
Because I feel chubby in my neck.
You feel a little, you got a lot there in your neck, huh?
Yes.
You want to treat it?
Yes.
And how long have you been thinking about it for?
Oh my God, doctor, that's my dream for a couple of years.
Oh, I see you. And we feel very honored that we can be a part of your dream. And hello, Josh, thanks for watching. That we can be a part of your dream, and we're going to do our very best job. I've been preparing my whole life just for this moment so we can do a great job for Mary. So I am Dr. Rich Castellano, the Smile Doctor. We're here in Tampa, Florida, and in the Villages, Florida. And thank you so much to my team, to Ari and Alex is here, and we have Charlene and Nina as well. And I couldn't do without them. They have everything set up perfectly for us. So now that we have everything set, and we already did the numbing medicine for Mary, and I'm going to go ahead and get gowned up. I do the cleansing solution with the Avogard for my hands. And so some of you, when we're doing these videos, you're asking the pricing. If you go to ImageLift.com/pricing, you'll see the pricing for the treatments there. Also, you can go to ImageLift.com/events and see one of our seminars. But we have millions of views on our Facebook, and people come in because they learn from what we're doing. They don't want general anesthesia. They don't want a full facelift. For the physicians and the students that are out there that are watching, also you can check out our website, practiceprofitabilitymd.com, where we teach other doctors. This is how we build our practice, and we'll teach you too. Our next event is at the Tampa Convention Center coming up October 18, 19, 20. So look it up, ppmdlive.com. Mary, you doing okay, dear?
Yes. May you give me a little water, please?
Yeah, we'll give you a little bit of water. All right, can you give me? We'll give her just a little bit of the water, a little sip. And what we do for the physicians and students that are watching, when patients are laying down like this, we've already given Mary some of the relaxing medicine. You can drizzle a little bit of water. So open real wide, and you just drizzle a little bit, a little tiny bit, and it's easy for them to swallow. Now they may think, well, can I really swallow? And they can. There you go. She's got a little tickle in her throat. There you go. Take your time. There, did you get it, dear? Take your time. Take your time. There you go.
You can turn your head on the side if you want a little bit.
Yep.
There you go.
Take your time. Take your time. Take your time. There you go. And sometimes if they get a little coughing fit, then we just give them another little sip.
Open.
So all of these things, they will settle and they will fade.
There you go. Feel better, huh? Good.
Is that a little bit better like that?
Yes.
Okay, good. Very good.
Maybe when I took the medicine.
You felt a little bit there? Okay. Very good. Now what we do is we measure heart rate, we measure blood pressure, we measure pulse oxygenation and all of those things. But most importantly, we talk to the patient. So, and we gave the relaxing medicine. So you feel that relaxing medicine settling in?
Yes.
Okay, good. Very good. So then what I do now, we've done all of the numbing medicine. So I'm going to do some of the lasers. So, yeah. And we're going to put these little eye shields over top. So everything's looking good. There we go. And we cover with the laser eye shields. Now you're watching on the video, so you don't need to cover with eye shields because we have the video here. Can you go ahead and turn the laser on for me? Now we're using laser lipolysis. Hello, thanks for watching. I am Dr. Rich Castellano, Tampa, Florida, and in the Villages, Florida, ImageLift.com. We're here today with Mary. And so we're using the Cynosure Smart Lipo Triplex. And you can see this is the helium neon beam. This is the device that we use for laser lipolysis. I like to add that to my facelifts. Can you please adjust the settings here at start? And so what happens is it will reduce the fatty tissue that's in the neck, and it also creates a thermal injury under the skin to tighten and firm. Mary, how are you feeling, dear? You doing okay?
And
So I'm going to set this right here. So we're setting up for the laser lipolysis. Everything's looking good. And then what I do is, we'll be doing the platysmoplasty, so I take the 15 blade and I'll just make a little incision through here where you'll feel pressure. If you feel any pinching, you let me know, okay? Very good. And since we've already done the numbing medicine, you don't feel any discomfort at all, Mary?
no, no,
Me neither.
no, not yet.
Yes, you're doing great. And if she feels a pinch, then I'm going to give her a little bit of the numbing medicine. Perfect. Then I use the bipolar cautery. And this is the bipolar, uses electrical cautery to electricity to cauterize the blood vessel. And you see, we do the procedure, there's very little bleeding. Do you feel a little pinch there or not really? And just as a precaution, what I'm going to do just a little bit of the numbing medicine here, tiny, tiny bit. Very small amount. A little bit here, a little here, a little here. Perfect. So then we have this submental incision. So for the physicians and students that are out there, hello, thanks for watching. Dr. Rich Castellano, the Smile Doctor. Now, so then, Alex, what you'll need to do is you'll need goggles. So you'll need to step out and we're all set. Otherwise, if you get, but yeah, you'll need some goggles. Thanks. Okay. Okay, so very good. So now, perfect. So now what we do is once everything's all set up and the laser is engaged, there's a foot pedal where I can activate the laser, and then the protection for the laser is number 1, patient keeps their eyes closed. Number 2, we use the eye shield. And number 3, I only activate that laser when it's in a safe place to do so. So you can see through here where the tip of the laser is when it's activating, and that reduces some of the fat cells. Mary, how are you feeling? Just got a little cough, that's okay. You doing okay? If you need another sip of water, we can get you another sip of water. You doing all right?
I think I need.
Another sip? Okay, all right, we'll go ahead and do that. So we'll give a little sip of water here. Thank you. And so we're not in a hurry. Sometimes we have to give a little sip of water. That's okay.
All right.
Open real wide. And just a little sip. There we go. Just small. There you go. Take your time. Perfect. You're welcome. Now, Mary, did you get a chance to read our book? Or you just came in for the consultation?
The consultation.
There you go. Everything's looking good. We're very proud of our patients. Mary's been wanting to do this for a while.
Thank you.
Oh, it's my pleasure. And you tell me, what did your family say when you were thinking about doing the lift? What did they say?
No, my family thinking it's hard, for the they believe it.
Aging naturally?
Yes, aging natural.
Aging naturally.
Yeah.
But you wanted to do it.
Yes, I think it's different. Yeah, I found you. Yeah, I believe in you. That's the reason.
Oh, thank you. Well, hold your confidence and trust in the highest regard. We'll take great care of you.
Yeah, it's not hard. Everybody thinking is, I don't know. Everybody's scared because they thinking is, a lot of pain. But no, I don't feel comfort. I don't know, in myself, I don't know.
Very good. Everything's looking good. So now we use the laser energy, and what it does is it creates a thermal injury under the skin. This is the 1064 wavelength, also 1320 combination. And I like to use it not only because it reduces the fatty tissue, but it also elevates the skin flap and it creates a little bit of hemostasis as well. So I'm using my other hand for the physicians and students that are watching. I'm using both hands, one to guide the fiber optic device through the metal cannula that we have, and then the other hand feels the tip of the device with my fingers, and I put counter traction on the skin to make sure that everything is where we want it to be. Everything's looking good, and I like to remind the patient it's important to tell them, hey, things are going well, you're looking good, you're doing fine. Because from the patient's point of view, they may say, well, is everything all right? They don't know, but I tell them, it's going well, I'm very happy, how are you feeling? How are you feeling, Mary?
Great.
Very good.
Great.
Very proud of you, things are looking great.
Thank you.
Now we will be rebroadcasting, so make sure that you're following either on Facebook or you can go to Instagram now.
Yeah.
Follow us on Instagram, facebook.com/ImageLift, or go to youtube.com/ImageLift. Everything's looking good. Perfect. And I can feel that the skin is lifting in certain areas. Perfect. If you feel any pinching, Mary, you let me know, okay?
Okay. For now it's perfect.
Perfect. Very
Yes.
good.
You can just like an angel hands.
Oh, you're so sweet. That's so sweet. Very good. Thank you for your comments. Thank you for your questions.
You deserve that. You
Oh. And we have, now again, for those of you who are just joining, I'm Dr. Rich Castellano, double board certified facial plastic and reconstructive surgeon. We're here in Tampa and in the Villages, Florida. And you can look us up at ImageLift.com if you want to know the pricing. What's the temperature there? The highest?
34.
Okay, good. The pricing is at ImageLift.com/pricing. We're also going to be placing some of the bruise patches for Mary today. So the bruise patches, my patients have been using Arnica montana for years. The herbal medicine helps to reduce swelling and reduce bruising. Research has shown all of that. Now there's a bruise patch called Acumen by Sierra, and full disclosure, they give us these patches so when we talk about them on the video, so we're thankful for them for their support, and patients are enjoying their products, helping to reduce the bruising, the risks. I've not seen any single patient have an overdose on taking too much of the Arnica. Of course, you don't want to take too much, but with the bruise patches, you change them about every 6 to 8 hours, and then, so basically, they're giving the medicine directly to where the treatment is, the facelift is, as far as instead of taking a pill or putting a cream on, the patch is higher concentration and easier to do, in my opinion. And the patch just feels cool to put on. So patients are enjoying that, and we'll be doing that later for Mary. Now, thank you all for your comments and questions. Thank you for watching. Please do share, because your family and friends are going to want to know. They say, hey, you saw a live surgery procedure today? Yes. We're doing a facelift under local anesthesia. We call it our ImageLift. We're also doing the upper eyes. And we're very proud of our patients. And Carmen found us through Facebook. Patients love that we do our educational videos on Facebook. And now Mary gets the chance to show hers there. Now, Mary, are you going to watch your own video? Or yeah, you see, yes. you can watch your own video now.
Yes, I watch.
She's going to watch it.
Yes.
So we're doing a facelift under local anesthesia. Thank you for watching, Dawn. And make sure you're also following us, ImageLift Now, on Instagram, and temperature over here, and ImageLift.com, or Facebook.com/ImageLift for Facebook, because we put videos out on both. Everything's looking good. So I like to use this feather touch technique where I'm just kind of I like my shiver technique, and I'm just really putting the laser back and forth under the skin, using a very broad area of where we are treating. Great. So Alex, if you're able to get a picture from this side so you can see the phone, that would be super. Coming around here maybe. Everything's looking good. Just make sure you're out of the shot. That's perfect. Very good. Are you feeling any discomfort at all?
No.
So this has been a wonderful tool in our practice because it removes some of the fatty tissue. Now I will do some liposculpture as well. I will trim the fatty tissue directly myself, but the laser lipolysis removes some of the fatty tissue, breaks it up, creates a dissection plane, and helps reduce the amount of bleeding from the procedure. All of those things are very helpful to me, and the thermal injury it creates to the skin is good for contraction of the skin, because we see scar tissue contracture over time. Even up to 6 months you can get continued improvement in the results. So even patients who just do the laser lipolysis alone, they can get a nice improvement, but it's usually never as good as if you are doing the lift. So it's a good addition. If someone wants to do laser lipolysis alone, temperature over here please, they just need to know that the result isn't as good as the lift, and maybe they'll come back and do a lift later, but it is a good no downtime option. Everything's looking good. Thank you for watching. Thank you for tuning in. For the physicians and students that are joining and you want to learn more about how we teach other doctors how to run their practice and take great care of patients and get great patient reviews, look us up at ppmdlive.com. That's our next event, October 18, 19, 20, Tampa Convention Center, or, thank you, or you go to practiceprofitabilitymd.com. We love teaching what we do. We love sharing. Okay, very good. So we're done with the laser portion. So I just write down the energy settings. And now what we do is I'm going to have you turn your chin all the way up. That's perfect, just like that. Thank you very much. So now, where we've already made a little bit of a dissection pocket, then I'm just elevating the skin a little bit more, removing the fibrous bands that connect the skin to the deeper structures. I will be trimming away some of that extra fatty tissue. I operate both left and right-handed. When you do this many facelifts, it's very helpful to use both of your hands. One, to obviously prevent fatigue of one hand, and it's fun to do. I love using both hands, play the piano, and play table tennis using both hands. And it gives me, it's just easier to reach certain angles using my left hand or my right hand. So I love to operate using both hands. Thank you all for watching, and make sure you are following on Instagram, ImageLift Now, or Facebook.com/ImageLift. Very good. Thank you for your comments. Thank you for your questions. Our events are at ImageLift.com/events. And if you have questions, specifically, you just give us a call, 813-463-9245. You feel a little pinch there?
Yes.
So she feels a little pinch, so what I'm going to do, I'll do a little bit of the numbing medicine, just a small amount, not that much. Just a little bit right in through here. Do you feel a little pinch there? Okay. Now how about through here? Do you feel a little pinching?
No.
How about here, a little pinch?
Yes.
A little bit. So just a little bit of numbing, but you can see she's still very comfortable. So Ragnell and Alfred, please. And so Ari uses the Ragnell and the Alfred. If you're just now joining, we're doing an ImageLift procedure under local anesthesia. That is a local anesthesia facelift. It is not a traditional lift. And then, as you can see, there's really very little bleeding to speak of, but if I need to cauterize a blood vessel or sometimes tie off a blood vessel, then we do that. And again, this type of procedure is just desirable to do under local anesthesia. Very good. Now, we've been doing video of our patients under local anesthesia for years. Before Facebook Live was even available, we did it on Periscope. And we had, I haven't counted, I mean, at least hundreds of thousands of views there. Yeah, can you show right over here, please? Now, you'll see a little bright light, and it changes the white balance just a little bit. And chin all the way up for me. Thank you very much. So I'm just going to get a little bit more exposure here. And when I'm doing exposure, I'm getting traction and counter traction. I'll use my forceps here to draw the tissues back, and then, yeah, you stay right in that position. Thank you very much.
You're welcome.
And Ari has everything set up perfectly, makes it very easy for me.
Of course.
Patients all the time are giving us compliments on our team, and I'm so proud to work with our team. They do such a great job. And I couldn't do it without them. Mary, how you feeling, dear?
Yes, fine, doctor.
Everything's looking good.
Switch.
Yep, let's go ahead and switch one, please. And I'll do just a little bit of cautery here. Thank you for watching. If you're just now joining, we're in Tampa and in the Villages. Mary has been thinking about doing a facelifting procedure for many years, and we're honored to be a part of this with her. When I was doing my training, we did all of our facelifts with IV sedation, almost essentially like a general anesthetic. But patients today, they don't want general anesthesia, and they don't want to be put out completely. They don't want to be put to sleep. Now, some patients, yes, but most don't. So we're giving patients what they want. Very good. Thank you for watching. Thank you for tuning in. Okay, perfect. And I'm using the bipolar electrical cautery to just seal the blood vessels. Gentle here. And sometimes it's just a little vein that's on the wall of the skin, so then you have to be a little creative to reach up and grab that area. Now that looks nice and dry, right over on this side for me, please. And I like to be very fastidious and fussy about making sure everything looks exactly the way I want it to. Okay, so I see one little area I want to cauterize here. Not quite sure why YouTube's being a little tricky. That's perfect. Okay. Mary, how are you feeling, dear?
Yes.
Everything's looking good. Okay, I'm going to change my light position a little bit here. Good. And what happens too is, for the physicians and students that are watching, sometimes you may have a blood vessel that may be a little more difficult to reach. And so you give it time, or once I do the platysmoplasty, it changes. There's a lot more space for me to work in. So I'm going to remove some of the fatty tissue. I'm going to do some of the liposculpting now. So what I do is I trim the fat until I'm down to the level of the platysma muscle. So you can see how I'm working there, and I'm going to turn the light back on so I see the platysma, and then I just follow that when I'm in the correct plane. Very good. And as I see little blood vessels that come up, I just cauterize them as we go. You feel a little pinch there?
Yeah, pero not too bad.
Okay, how about now? You feeling pain? So now I've just got a perfect plane here, right on top of the platysma level. That's a subcutaneous plane. I've lifted the skin, so this is subcutaneous fatty tissue, and we're going to remove that. We figure that Mary doesn't want that anymore, so we're going to take it out of there. Now, I tell patients for recovery, hi, yeah, thanks for watching, Maddie. Okay, so we'll get rid of that. And, you know, there are treatments like ultrasound, there is thermage, there's the radio frequency. Feel a little pinching here. Feel a little pinch there? Not really. I'm gonna cauterize a little vein. And those things can help the neck, but there's a lot of patients that may spend the money and get no results. So you can do those treatments if you're okay that you spend the money knowing that you may still need to get a lift or do something else. If someone says, well, I don't want to spend the money, and then maybe still need another treatment, then you should not do the ultrasound or the non-invasive treatments. That's why it's important to get a consultation first so you can really understand your options. Everything's looking good. If you're interested in our events, we have an event coming up next week, one of our seminars, and seminars are, patients love our seminars. I forget, is it Citrus?
Next one.
I'll have to find where the next one is, but it's on ImageLift.com, Valrico. ImageLift.com/events. Can you show me over on this side, please? So Ari's doing the exposure for me. We're using a Ragnell, and we're also using a Alfrecht retractor. So getting rid of some of the fatty tissue here. Everything's looking good. And then I'm lifting the skin away. And in addition to clearing the area, there's very little bleeding, as you can see here, just a tiny bit. It is a little bit of a dissection when you put the gauze in. Sometimes you can lift and expand the area. So there's little tiny veins that are over here that we're going to cauterize. Very minuscule. And I place the gauze in first, and then I look for the areas where you see the little bit of heme. Perfect. Now, also doing a good job with hemostasis helps to minimize the bruising, but we will be using the bruising patches as well. Hello, Anilis. Thank you so much for watching. Right here. And when you're cauterizing veins on the surface of the skin underneath, you just go for the highest point, because you may see a little bit of heme across the area and gravity. You follow gravity, so you look for the highest point and you nip it in the bud. Okay, so we've got great exposure here. Everything's looking good. Thank you for watching. Please do share, and you can join us on Instagram at ImageLift Now or on Facebook, facebook.com/ImageLift. Perfect. Mary, how you feeling, dear?
I feel okay, doctor.
So we're trimming. This is the liposculpture. So as I do, and I lift some, then I just take a little swath of the fatty tissue. Okay? And I get rid of that, and then I go right beside it, and if I just take a little bit here, a little bit there, before you know it, there's quite a big reduction in the fatty tissue in the neck. I'll do just a little bit of cautery there. Now we do the prep ahead of time. We like to use the Hiba cleanse. Prep on the skin, prep and drape. I like to see patients 1 day, 1 week, 1 month, 3 months, 6 months, 9 months. I see patients, I give them my cell phone number. I'll call them later this evening to check in. We did another lift today, and we also did eyelids, which some of you guys saw on our previous video. Perfect. So just trimming and sculpting, lipo sculpture. Very good. Thank you for watching. Yes, thank you. Rosa Dramos, thank you for your comments. You feel a little bit of a pinch there, Mary?
No.
If you feel any pinching, you let me know, okay?
Okay.
Very good. Mary says she likes to watch the Avengers, so tonight is the Avengers. So I feel so honored that she didn't go to the opening of the Avengers. She came for her lift. I feel so special. You could have gone to see it, but she said that is not as important as coming to see Dr. Rich. All right.
That's true.
That's true. I know.
Yeah.
This is important. She's
Yeah.
been wanting this for years, and you're going to love your results.
Yeah, thank you. Lord.
That's my job. I want to make sure you're happy.
Thank you. Lord. I hope.
You're going to love it. We're
Yeah.
going to make you happy. You're going to love it.
Okay.
So I grab a little bit of the fatty tissue. I go down to the level of the platysma muscle, and I take just a little swath of the fatty tissue. And you take a little here, a little there. Before you know it, you have removed the subcutaneous fat in the area of the neck. Okay. That is causing the hanging down. And, you know, we have these names for what we call our neck, and they're just usually not nice. They say it's the turkey neck, the waddle. I guess if they say you have a, can you show over here, please? A swan's neck right here, Ari?
Oh, sorry.
Yeah, that's fine. That's not a bad angle to get the phones there, Alex, as well. From here, right here, you can see. Everything's looking good. Seeing what the phones see. Perfect. So we monitor heart rate, we monitor oxygen, we monitor blood pressure, but most importantly, we monitor the patient and make sure that they're feeling comfortable. Mary, you doing okay, dear?
Yes.
So I'm going to remove a little bit more of the fatty tissue, then I'm going to do the platysmoplasty. That's where we do a little stitching and it'll feel tight in the neck. And that's what we want. That's what we're here for. Little cautery here. Do you feel a little bit of a pinch there?
Yes.
She feels a little pinch, so let me do some of the numbing. How about here? You feel a little pinch?
No.
Patients feel comfortable. We make sure if they don't feel comfortable, then I don't feel comfortable. Perfect. So then right submandibular, there's just a little bit of fat that is there that if you can trim that area below the margin of the jawline, you really get a lot sharper jawline. And this is the difference between some people will get a lift and they say, if they really like their lift, or they say, you know, so experience counts. A lot of people know how to do a facelift. That doesn't mean they're any good at it. So these little things make such a difference in being able to get your best results. Okay, so I've removed enough of the fatty tissue that what I'm going to do now, just a little bit, is I'm going to do the platysmoplasty. Now, when I do the platysmoplasty, I like the Ethibond suture. It's a 2-0. It's a permanent suture, and it stays, gets covered in scar tissue. And sometimes they can surface like a splinter that's easy to take care of. So here we go, the 2-0 Ethibond. I'm going to turn your chin all the way up, and this is what we call a platysmoplasty. So I take the edges of the platysma, a corset platysmoplasty, and I bury the knot. Burying the knot means the knot is on the deeper aspect of the knot, so it's less likely to extrude or come out. And for the physicians and students that are watching, if there is a suture extrusion or a suture that comes out, it can act like a splinter. What does a splinter do? Well, it can, you see it like it's a pimple. And what do you do with the splinter? You remove that. When you remove the stitch, then symptoms all go away. It's like a little foreign body reaction. So most patients don't have to worry about that, but if it does happen, then we take care of them and get it addressed. But if a suture comes out, then by the time it comes out, the scar tissue and the result has already set, so it doesn't hurt anything to remove the stitch. Thank you for watching. We've got Delia says, oh my, I don't know what I feel. So this certainly isn't for everyone. We like to share this so that people can see what is possible. And what happens is that most people will decide that they just don't want it under general anesthesia. They want to look natural. They don't want a traditional facelift. And that's why they come find us. A lot of surgeons, they may be very good surgeons, but they don't focus on the face. So that's all we do is focus on the face. Now if I'm doing the face and I pull really, really hard and tight, sometimes the tummy and the breast will pull up a little too. I'm just kidding. But we only focus on the face. Mary, how you feeling, dear?
Good, Dad. Very well.
Good, good. If you're happy, then I'm happy. If you're comfortable, I'm comfortable.
Thank you, Dad.
And I tell patients, I say, look, if we need to come back and take a little more, then that's better than going too far. Now for Mary, I don't think we're going to have to do that, but it's with any procedure, knee replacement, hip replacement, gallbladder, tonsils, appendix, sometimes you do have to go back, but we want to minimize that as much as possible, and we want to make sure, so safety number one, you must look natural, prevent future aging changes, and then give you as much improvement as possible. Now we take before and after pictures because there's a famous plastic surgery saying that after you do a cosmetic treatment, our vision will get better and our memory gets worse. Hello, thank you for watching. So when you do a treatment, we really scrutinize ourselves very closely. And notice we learn new things. The vision gets better because we don't look at our faces that closely except for when you do a cosmetic treatment. And the memory gets worse because we forget what we used to look like. That's very consistent. So the photos help to show us and keep us on track. Now it's also important when we tell people, listen, we never see ourselves the same way that other people see us. Why is that so important to talk about? Because patients come in if their expectations are high, or maybe sometimes we can be hard on ourselves. And you don't want to be too hard on yourself. That's why we say, listen, we never see ourselves the way that other people do. But do you know why we don't see ourselves the way that other people do? The reason why is when we look at other people, we glance and we're social. Hello, thanks for watching, Diana. We glance and we're social when we look at other people. But when we look at ourselves in the mirror, we do not glance. We stare and we glare. Go ahead, can you pressure? And we look for the imperfections. Mary, how you feeling, dear? You doing okay, Mary?
Yes.
Yeah, okay, good. Everything's looking good. Charlene still there?
Yes.
Fine, thank you. Can you ask Charlene to step in? Thank you, great job. Everything's looking good. Hello, Sarah. Thanks for watching. So, if we stare and glare at ourselves, you know, you don't just focus on the imperfections. You're gonna feel miserable. So don't feel miserable. Don't be too hard on yourself. Can you just fix the pulse ox for me, Charlene? Thank you. Everything's looking good. Now let that go for a moment. And so you can see, wow, what a big difference in the neck and jawline so far. We've removed a lot of the tissue. You may see little irregularities. They're all going to even out, especially when we pull back from here. So thank you. Right here, can you expose for me? Now that I've done the platysmoplasty and I have better exposure, now I can go back and I can trim a little bit more of the fatty tissue if I choose, or if I see a little bit more. Sometimes the platysma muscle can be so thin, it's just very difficult to see at all. So I think we've gotten a lot of contouring here. Now I'm going to come from the other side as well, that I'm going to be tightening with the lift. Stay right there for me, please. Mary, do you feel any pinching at all?
No.
Okay, can you show me over here for me,
Sure.
please, Ari? Everything's looking good. Thank you for watching. Thank you for sharing. Your family and friends are going to be upset if you tell them you were watching a live procedure and you didn't share with them, because they want to know. A lot of people are unaware that you can even do these types of things. Everything's looking great. I see a little bit here just right under the margin of the mandible. Perfect. Okay, release for me, please. And so I see a little tiny dimple of the skin. So what I'm going to do is I'm going to release that dimple. And I just elevate the skin around, and I may make it look easy, but what I'm doing is I'm carefully making sure that I'm pulling up on the skin. There we go. And then they did your neck procedure. They did your neck surgery here in the past, Mary. How long ago was your neck procedure?
4 years ago.
Yeah. And so she had that incision, which is no problem with the facelift. I just lift the skin around it. Now release for me again. And when we pull, it's going to be perfect. Now I'm going to thin out some of the fatty tissue right across here, right through the front. Perfect. Thank you very much. And I can use the tips of my con scissors to just bring the fatty tissue away, trimming tiny bits of fat. The littlest amount of fat removal can make the biggest difference. Very good. Okay. Release for me again, please. And I'm going to do just a little more here, because she has a little bit of the scar tissue from when she did the procedure, and that's fine. That's to be expected. So then I'm accounting for that. I'm accommodating for that. That little bit of scar tissue that's there. Okay, perfect. Okay, now what we're going to do, and I look and it looks nice the way we want it to, and I'm going to have you turn your head all the way this way. Very good. And so I'm using the fine tooth, and I go back to the 15. I think we might need a little more gauze. So now this is the 15, and I'm going to adjust this over here, and then turn just a little bit more for me. That's perfect. And so there's a little swelling with the numbing medicine. Can we get some more of the gauze, please? Thank you. I'm going to remove a little bit, just a little bit of the hair here, not too much, and it all grows back in this area, so the incision hides very nicely in the hairline right through here. You'll feel pressure. If you feel pinching, Mary, you let me know, okay? Perfect. And it's right in the skin crease, so it hides and heals very nicely. Right along the edge of the tragus. The tragus is Latin word root for goat. It's like a little billy goat's chin. And then the little structure below, we call this the antitragus, right across from the tragus. All these fun names we have for medical nomenclature that makes us doctors feel very special when we know our anatomy. You feel a little pinch there?
No.
And then I carried the posterior auricular incision. Can you hold that forward for me?
Sure.
Now Ari holds that together. All right, thank you, Nisha. Thanks for watching. Thank you for sharing. Please make sure you're following ImageLift Now on Instagram. And we will be doing our live events coming up for our patients. Go to imagelift.com/events, imagelift.com/events, and ppmdlive.com is going to be our event at the Tampa Convention Center, where we are teaching and training doctors how we have such a successful practice. How do you train your team? We get so many compliments on our staff. The number one reason for my success today, that we have thousands of patients that we've treated, and we're growing one of the busiest practices in the United States for a solo facial plastic surgery practitioner, is because of my team and the way that we train them. So if you feel your team is not where they need to be, you need to call us. Give me a call. Happy to help you. It is such an honor to have doctors tell me we've increased their revenue, increased their profitability, and increased their quality of life, because if you're a doctor and the practice is not running well, it's miserable. I mean, it really is just not a good feeling. To know that you could be doing more, but you're not because your team is just not on board. They're not trained the way they need to be. So now we've lifted the skin flap here. Everything's looking good. Thank you for watching. Thank you for sharing. So now I go back to the cons, and it's easier for me left-handed on the cons here, the cons facelift scissors and the Brown Adsons. So traction, counter traction with the tips of the cons facelift scissors. After we do this, we'll do the eyes. Now I will connect the pocket down below. So right through here, I can feel I've entered the pocket of where we were doing the platysmoplasty. And these are sharp only on the inner surface of the cons. The outer surface is dull, but I find that that's fine to just get a nice, easy dissection. You see how quickly the skin flap elevates. Everything's looking good, Mary. How are you feeling? Oh, she feels a little pinch. So when she feels a pinch like that, then what I do is right here, I put a little numbing. So you feel a little pinching, little numbing. You feel a little pinch there?
Yes.
Little numbing.
Yes. Okay.
How about here? Little pinch? Not too bad?
Not too bad.
And she may not even feel the numbing pinches because she's already pretty numb there, but she just feels a little tiny bit, and then I know exactly where I need to go. Perfect. Take a big, deep breath in and out for me. That's perfect. Very good. So we lift the skin. This is a subcutaneous dissection. We expose the SMAS, the subcutaneous musculoaponeurotic system. And there's just a few of these fibrous bands that connect the skin to the deeper connective tissue structures. The SMAS envelops the facial musculature, and that was a big breakthrough in facelift technology, facelift science, facelift technique to tighten the SMAS instead of skin-only facelifts. And I love to add laser in addition to that. Now, not all doctors will add the laser, but I think it certainly helps me. I enjoy the results I get. Hold this for me. Hi, Bernice. Yes, we do travel to other states and we do our teaching and training. Anna, we're doing a facelift under local anesthesia. Thank you all for watching. If those of you who are interested in the pricing, you go to imagelift.com/pricing. Thank you to Build My Bod for helping us put up our price estimator. And if you want to know our events, imagelift.com/events. So then I'm just feeling the pocket is nice and open. I feel the connection between the two. And of course the laser lipolysis elevated some in through here. Very good. Thank you for watching. If you're just now joining, we're doing a facelift under local anesthesia. I call this my ImageLift procedure. It is me doing the procedure. There's no other doctors that are doing this in this office. Patients come and they say, am I going to get you or am I going to get another doctor? You're going to get me. That's what they come here for. Perfect. Okay, exposure. And I'm going to turn your head just a little bit this way, Mary. Thank you very much. Okay, so now what I do is once I've elevated the skin flap, I get a good look at everything that's here. There's really no significant bleeding and a little vein on the surface of the skin. I'll do some cautery here to just make sure that it's nice and dry, and that of course minimizes bruising. Very good. Now sometimes when you are exposing and retracting, you can actually cover the veins with the retractor. And if you're really retracting super tight, for the physicians and students that are watching, you can even mask an open vein that you would want to cauterize by just compressing it with your tension of your retraction. So I like to sometimes have them loosen the retraction just a little bit. So now that I've done some of that cautery, and I'll go check it again, but it looks pretty good now, and I'll recheck it later just to be double, triple sure. Everything's looking good. How are you feeling? You doing okay?
Yes.
All right. So now I use the 2O Ethibond suture. Hello, thanks for watching. Dr. Rich Castellano here, the Smile Doctor. So now I'm doing a SMAS plication. I've done SMAS plication, I've done SMAS imbrications. I found that they can be very comparable in their results. And so this allows the SMAS layer to be tightened. Perfect. And tightens up the neck and the jawline. Now, can I make things gone 100%? I can't make it gone 100%, but I can make it better. So now that I put this suture in place, I tighten things up and double loop, surgeon's knot, tightening things down, and then we call it flashing the suture, where you clamp it with the hemostat, or that is actually a needle driver. This is all done in the office and you go home the same day. Thank you for watching, Bernice. Okay, and I take that suture and I go back and forth like this because it cinches down the knot. And I'm cinching down that knot, I hold it really tight, then back, forth, that's 3, and then this is 4 to make sure, so that's 4 knots on that, and we cut right on the knot, because if you leave a tail, you can give some opportunity for that stitch to extrude later, so you really want no tail on deep sutures that you're cutting. So I'm grabbing the SMAS more in the cervical region, and we'll tighten that back to the mastoid fascia. And I will be using another Ethibond because I don't think there'll be enough of this one.
Sure.
For the other side. And thank you again to Ari and to Charlene and all of our team for setting everything up perfectly. I'm going to turn your head just a little bit here. So I'm tenting up the tissue and then driving that stitch through. The stitch will follow the curvature of the needle. Perfect, and there's the other end. So, surgeon's knot, double knot, tightening things down. We will flash this suture with the needle driver. Thank you for watching. We will be rebroadcasting. We're going to switch to the other side in a little bit. I'm going to be doing the eyes as well. So back and forth to tighten up the knot. And I want to get one more little area here. Exposure, please.
Yes.
Hello, thank you for watching. Down over here, please. Yeah, that's great. Perfect. Yeah, I like to fuss over the details. You want to make sure it's just right. Don't leave until it's just the way you want it to. Behind the ear, please. Okay. Okay, suture's in great position. Surgeon's knot. Cinching that knot down, we'll flash the suture with the needle driver. We pinch that so that it holds the tension while I throw the second knot. So I throw the second knot right on top of that for the physicians and students that are watching. And then back and forth, I'm tightening down and cinching down that knot to make sure it stays in good position. There we go. And then I hold and expose so that they can trim right on the knot with no tail. No tail on deeper stitches, skin stitches where you're going to remove them or they're going to dissolve. Yeah, leave a little bit of a tail because then it's unlikely that that knot is going to fall apart. Okay, perfect. So I like to use in front of the ear the 2-0 Vicryl suture. This is a dissolvable suture that lasts 4 to 8 weeks, and we are tightening the SMAS preauricular. So I grab some that is closer nasally than back towards the ear, and more nasal, and then back towards the ear. And this is just kind of a bolster for the other stitches we've already put in. At this point, the SMAS really does not move that much from where you have tightened it to, but every little stitch bolsters and helps it to be in place. Hello, Melba in Daytona. Happy to see you if you have any questions. Everything's looking good. Thank you all for watching. Very gentle and delicate. Don't move
Okay,
at all.
okay,
Just keep
okay.
that right in the position. Yeah. Because if you move that knot, it can actually pull the suture out. That's perfect. Okay, very good. Everything's looking good. Thank you for watching. Thank you for tuning in. Hello, Pauline. Thanks for watching. Yes, yikes. Pauline says yikes. Mary, how you feeling, dear?
Yes.
Big, deep breath in and out. That's perfect. I'm going to turn your head just a little bit this way. Thank you. Very good. Okay, this question in Spanish. ¿Qué tipo cirugía es de facelift? No está facelift total. Es de anestesia local. Okay. General. Okay. Hablemos español. Llamar a la clínica 813-463-9245. Hello, Rosanna. The unlifting. That's funny. Thank you all for watching, and thank you for sharing. Make sure you share with your friends, because if you tell them you are watching live surgery and then they say, well, you didn't share it with me, they're going to get upset with you. So just make sure you let your friends know. So now I'm trimming the skin where the lobule or the earlobe is going to set in place. Now that is one iteration, and it fits nicely. As I cinch it up and start stitching, if I need to adjust and trim more, I will. And then I can also see I've got some excess over here that I'm going to be trimming off. And you can see that in the video. This is what's we're going to remove. Hi Melba, our clinic is located in Tampa and in the Villages, Florida. Look us up at ImageLift.com and you can see our events. We have events out in Wesley Chapel. Events are at ImageLift.com/events. And for the physicians and students that are watching, we do a lot of training on how we do social media, teaching and education. If you want to learn more how to do the most out of social media in your practice, give us a call. PracticeProfitabilityMD.com. We have a lot of fun teaching our doctors. And we'll be teaching at the ASAPS meeting in New Orleans for the plastic surgeons that are watching. We'll be at the ASAPS meeting in New Orleans. You're welcome. That's coming up middle of May. Cauterizing the tissue edges here. You're going to see a bright light now. And I just want to make sure I'm not missing anything at all. So I shine a little light, extra light on the situation. Everything's looking good. And I also will pass a gauze from here through submentally just to make sure that we're under control. And I see there's just very little heme, very little blood, which means we're doing a good job. Hello from Longwood. Okay, and I'm going to do, just want to check this one area. No, that's pretty dry. Okay, and then a little bit here around the ear. Mary, are you feeling any discomfort at all?
No.
Behind the ear for me, please. Very good. My team has set things up perfectly. Once you sign up for a consultation, we like to do a pre-op appointment, and we go through all of your instructions at that time, get all the paperwork, and make all the arrangements. That way, when you show up, you can just show up, you got your prescriptions, and you can just have the procedure done. Release. Can I have the Vicryl suture, please? So now I'm going to do the deep stitches to put the skin flap in place. Mary, I'm going to have you turn your head this way a little bit. Is that okay for you like that?
Yes.
If you feel you need to adjust, let us know. Hello, Pauline. Thanks for watching. This is not a full facelift. It's not a half of a facelift. This is a modified facelift. I call it the ImageLift with laser lipolysis. So the most important ingredient in facelifting is who is your doctor, what is their experience. Because just because someone knows how to do a facelift or they may be credentialed to do a facelift doesn't mean that they have a lot of experience doing them. And what are the results? So the ImageLift does not need general anesthesia, no surgical drains, no surgical staples, no cut across the top of the head, no IV sedation is necessary. Everything's looking good. Now we will be rebroadcasting here in just a little bit. Okay. Now also one of the things that I do, so I'm going to put this stitch in place, and during the procedure, from time to time, I do like to change my gloves, and so I am going to do that here coming up because I'm going to do the eyes. It does not hurt. Hold that forward to change your gloves. Perfect. Trim that for me. And when you're trimming the knot, what's important too for the surgeons or the students, when you're trimming, you want to make sure you trim and stay in one place. It's easy to trim, and sometimes if you don't cut it completely, you can pull, and that can put tension on the suture. So you want to avoid things like that. These are the little technical details. You can leave that alone for right now.
Okay.
Hello, Rosanna. ¿Dónde clinic? Está en Tampa, in the Villages. Okay, very good. I'm just going to change up my gloves here. Everything's looking good. Mary, how you feeling, dear? Perfect. Okay. And all right. So those of you who are just now joining, thank you all for watching. I'm Dr. Rich Castellano, the Smile Doctor, double board certified facial, plastic, and reconstructive surgeon. And we're doing a facelift for Mary under local anesthesia, the ImageLift. And just to show you as well, it's been a little while since we showed you this. Just to catch up, you can see here are her pictures from before. There you go, you can see all that there. And now we're tightening up the neck and the jawline. We're going to zoom in a little bit more. Okay, very good. And we monitor blood pressure, we monitor oxygen, we monitor heart rate, but most importantly, we monitor the patient. I'm watching the patient. I see every breath they take, as the song goes with sing. And if they move or wince, they're usually resting so comfortably. If they move at all, I know it. And then I say, oh, did you feel something? And they say, oh, maybe I feel a little something. If they feel pain, we give them relaxing medicine or numbing medicine straight away, and they feel comfortable. Mary, how are you feeling, dear?
Yes, fine, perfect.
So big thanks to Mary. Lots of shares for Mary because she was so kind to let us do a teaching video for her procedure. And patients love learning about what can be done. This is the beauty of social media. We have our global broadcasting system that is literally in our back pocket in our cell phone. Thank you. Can you mark that down? That's perfect. So I'm using the 2.0 Vicryl. Bernice says, do we come anywhere near Kansas? Well, we don't do procedures out there. We do our procedures here, but I'm sure we'll have a meeting out in Chicago will be the closest we'll be in that area. I lived in Kansas for a little over a year. When we were young, but we don't do procedures out there. Now we do have patients who come from Kansas. Here we have a lot of patients who come from out of town, and Florida's a great place to be to begin with. So these are the deep stitches, and you can see even if I just put these stitches alone, the skin can heal pretty well in place, but I'm going to do an extra layer of protection and make sure that the skin is where we want it to be. So drawing that through double surgeon's knot, this is a deep suture, so it brings the skin edges together perfectly. And I'm making that a super tight knot. Okay, and now I'm going to use the chromic, and I'll use the, here you go. I'm going to do a little bit of numbing for the eyes. So, Mary, you're going to feel a little pinch here on 3. 1, 2, 3, pinch, little numbing. You feel big pinch, little pinch, not too bad?
No.
So with the numbing medicine, that allows us, we're going to do the upper eyelid procedure. It's a skin only. It is one stitch technique. There's one stitch that runs across the top of the eyelid. Thank you for watching. Thank you for sharing. Yes, hit the button for Charlene. We have a lot of patients that come through want their eyes done because the skin can even block the vision. But what we do is traditional eyelid procedure would take skin, muscle, and fat. You want to leave the muscle local. You want to leave the muscle and the fat for most people. Sometimes I will take them. Let me have them turn your head this way. Mary, can we tell them how young you are, dear? ¿Cuántos años tienes? Can we tell them?
Yeah.
How young are you, dear? Pinch.
Oh.
She was a little pinch. How many?
62.
62. And she does not look her age. Patients are living much longer, spending more time with family, more time with grandkids, sometimes working longer. So
That's true.
Mary does not look 62 years young. We're very proud of her. Proud to work with her. Many more years ahead for her. Okay, so now you see the eyes are swollen. That's the numbing medicine that we've done. Can you open your eyes for me? It'll be hard to open the eyes. That's okay. But it'll start to feel very numb here. Go ahead and close your eyes so you can see. All she has to do is keep her eyes closed and everything's fine. Let me have you turn your head all the way this way. I'm using the tenotomy scissors. You hit the button. Okay. Because I want to trim the skin along the tragus here. Just a little tiny bit. Perfect. Just a little bit of skin removal. And Chromic, please.
Yes.
And let me have you turn your head just a little bit through here. That's perfect. So now I'm going to do the little stitches in this area. Thank you for watching. Thank you for sharing. If you're just joining, I am Dr. Rich Castellano, the Smile Doctor. This is a 5-0 Chromic, which is a dissolvable suture. And you can see here, very tiny stitch. These stitches fall away on their own. Sometimes we will remove them. I place a stitch every 2 to 3 millimeters, sometimes 4, but usually every 2 to 3 millimeters. Ari controls the hair, and then I have a little bit of that suture remnant that I am grabbing onto to throw these knots in. So I'll throw multiple knots here just to, it's the anchor stitch. And go ahead and cut for me. Tail on that for sure. You don't want to cut right on the knot because you don't want it to loosen up. Thank you very much, Margarita. I appreciate that. Thank you for watching. Please do share if you enjoy what you're watching. Please share so your family and friends can see and let them know this is the way of the future. People do not want a full traditional facelift. They don't want general anesthesia. They want to look younger. And they don't want to look extreme or severe. So I counted, I've probably at least done over 1 million stitches in my lifetime. And, you know, you just get the hang of it after a few thousand. Everything's looking good. Thank you for watching. Thank you for sharing. Make sure you follow us on Instagram, ImageLift Now. ImageLift Now. Very good. And we're also on YouTube, imagelift.com/ or youtube.com/ ImageLift. Very good. I'm grabbing that skin on the tragus. And Ari's following the stitch for me, making it easy for me to place the stitch when that stitch is out of my way. Because the sutures can actually come in and block you trying to place other stitches and create knots when you don't need them. So if your assistant is holding that suture in the right way, it just makes it so much easier to place a stitch. Perfect. Can you adjust this one over here a little higher so that way it centers on her face just a little bit more? Thank you. The one on top, yeah. There you go. Yeah, that's good. Yeah, that's perfect. Thank you. Thank you to Charlene and thank you to Ari for... Oh, hey, Charlene, there's an appointment that I have at 5:30 and I just need you to...
It's already taken care of.
They called them? Okay, good. Yeah, thanks. Thank you. Yeah, if we have an appointment and we're running late, we just tell them we got to reschedule because we're in surgery. So I like to see patients after the lift 1 day, 1 week, 1 month, 3 months, 6 months, 9 months. Physical versus social downtime. Physically, you'll get back into your routine, errands, shopping, things around the house within a day or two. Socially, we pass the grocery store test. 7 to 10 days, you walk into the grocery and no one really does a double take. And patients don't want extended or prolonged recovery if they can avoid it. The eyes add a little bit to the swelling, but not really much to the physical downtime. Perfect. Everything's looking good. How are you feeling, Mary? Okay, good. If you're happy, if you're feeling good, then I'm feeling good. And everything's going very, very well. Pull the ear forward for me. Perfect. Even though these stitches are hidden, we take extra special care along the back of the ear also. It's a tricky place to stitch. But we place that stitch to make sure we get the best results. Very good. If you're unsure, it's always good to come in for a consultation. If somebody comes to us and they tell me they want their very best result, there's no discussion. We know how to do that. It's combination treatment. We combine tightening, volume, and skin. If somebody wants their very best result and they want to do just one procedure, then we talk about lifting. If somebody wants their best result, hi Linda, thanks for watching. If somebody wants their best result with no downtime, usually we do laser, or you can do IPL treatments and things like that. So the IPL and no downtime treatments are filler treatments. They're great, but they don't replace what a lift will do. Lift is always going to do better. And facelift results are awesome, but you can get even better results yet when you're combining lifting plus laser plus skin treatment. So when patients ask me what they should do, I say, well, what's your outcome? And then we can create a plan that is right for them. So now I've got this last little stitch and I'm just going to tie the knot onto itself. And as you can see, no surgical drains, no surgical staples. We're going to do the eyes next, then the other side, and then we're all done. Mary, everything's looking really good. You're going to love it.
Thank you.
Okay, this is for you. Let me turn your head just a little bit this way. Can I have the local, please? Recycle VP one more time. So just a little bit more. 1% lidocaine with 1 to 100,000 epinephrine. You feel a little pinch here or not really?
No.
So we try and make it easier than the dentist's office. Is this easier or harder than the dentist?
No, that's easy.
Oh, good. And we try and also try and make it easier than going to get a tattoo. And then 15, where I am making a skin incision down to the level of the orbicularis oculi. And for the physicians and students that are watching, you can see me putting traction, counter traction on the skin. When I'm pulling it apart, it makes it much easier to remove the skin and make a very precise incision. And Mary doesn't feel a thing.
Yes, I don't feel that.
So now Mary's been watching our videos. Now her video is there, going to be there on Facebook, and you can watch it too. So I'm excited for Mary. She can watch it. But then, and when she's ready, she's going to go watch the Avengers too. But not now. Facelift first. ImageLift is more important
I know.
than invention. We're very proud of Mary for understanding the difference. It's so much more important than the Avengers. But that is an important event too. So, but she's going to get to do both. Okay. So we've trimmed the skin, and you can see here down to the level of the orbicularis, and you can see here is the extra skin that we removed there. All right, and so that is about almost 15 millimeters in height. So we're using the bipolar cautery, and you feel a little bit of a pinch there?
No,
Feel a little warm or anything?
don't dirty.
Very good. And then I like to use that 5-0 Proline. Thank you for watching. If you're just now joining, this is Dr. Rich Castellano, the Smile Doctor, double board certified facial plastic and reconstructive surgeon. We're going to be doing our conference in New Orleans in May. We'll also be out in Austin here, May 1st for COSM. We're presenting there. 5-0 Proline, very tiny, tiny, tiny suture. Let me turn your head just a little bit here. There you go. There, and you can just relax. That's perfect. Very good. Mary, do you feel that relaxing medicine? You think you need a little bit more, or do you feel comfortable?
No.
Okay, I feel pretty relaxed too. Very good. So this is a running subcuticular. I'm just placing the stitch below the epidermis into the substance of the dermis to bring the skin edges together. It's called a running subcuticular suture. It leaves no external suture marks except the entry and exit on the medial and lateral aspect of the eyes, but you don't really see those. And we take the stitch out at 1 week, sometimes 2 weeks if maybe there's a little delay in healing, or I have some patients that have diabetes or a smoker. And if they need a little extra time, we keep that in. But the stitches are so small, if you're wearing readers or sunglasses or glasses, you really don't see them very easily. So patients can go back to work, and some people do a cosmetic treatment. They tell the whole world. Some people don't want anyone to know. So depending on your level of modesty, you still can usually hide a lot by doing the eyes. But you're ready for the grocery store test. It's about a week after doing the eyes. Hello, Janie. Thanks for watching. Thank you all for tuning in. Dr. Rich Castellano here, the Smile Doctor, double board certified facial plastic and reconstructive surgeon. Thank you for your comments, and thank you for all your questions. Those of you that were asking, because we're broadcasting now on Instagram Live, Facebook Live, YouTube Live, and we're also recording. So if you are curious about pricing, we get that question a lot. You go to imagelift.com/pricing, or give us a call, 813-463-9245. Although it is after hours now, and the phone rings through to my phone, so you won't get answers today. You have to call tomorrow during business hours, or just go to imagelift.com/pricing. And if you want to come out there, hello Barbara, thanks for watching. Hello Janie. If you want to come to one of our events, which I highly recommend, we feed you, we got food, the food is great. We have one in Valrico coming up tomorrow. imagelift.com/events. I grab the suture, little loop here, and make a knot, and then one more time over here, grab that little knot, which is very tricky. Here we go. Everything's looking good. I got such a small suture. I'm going to get some help from my forceps here. There we go. Perfect. Okay, so thank you for your comments. Thank you for your questions. Cut, please. Yeah, that's good. If you're just joining, I'm Dr. Rich Castellano. Someone says, do you ever come to Oklahoma? I have colleagues out there, but really to do what we do, patients come here. We have patients from Oklahoma who come out to see us. And we have travel patients from all over the world. Because patients aren't coming to us for a facelift, they're not coming for filler treatments. They're coming because they want my experience. They're coming because they want our team that does such a great job. So now what we're going to do is I'm going to do the other side. We're going to take a break. We're going to rebroadcast in just a little bit. So thank you all for watching, and we'll see you soon on the other side. And thank you, Mary. You're doing great.
Thank you.
You're welcome.